to Human Health and Kindness. My name's Carol, and today we're going to be talking about what is diabetes? So while in nursing school, I have to learn about diabetes because so many people in the United States and even outside of the United States suffer from diabetes, and many people don't even know that they have it. So when I was learning about what diabetes is, I realized it's a disorder having to do with insulin. Before we understand what diabetes is, we have to understand how a body works that does not have diabetes. Eat something, our body recognizes that our blood sugar goes up. When our blood sugar goes up, our pancreas releases what's called insulin. Insulin works like a key to unlock the cells of our muscles and our fat cells. Then once that glucose enters, then we can use all of the food that we've eaten as energy. In a person with diabetes, what happens is either they're not producing enough insulin, not producing any insulin at all, or the cells are just not receptive to the insulin that is available. So with type 1 diabetes, this usually has a sudden onset. What that means is this person is usually at a state where their blood sugar has gotten so high that they have to be in the hospital for an emergency. Usually this person is below the age of 20 when they're diagnosed, and it's characterized by no insulin production at all. So what that means is when this person's blood sugar increases after eating a meal, there's no insulin that can allow that glucose or that sugar to be taken in by the muscles and fat. Due to this person having no insulin production at all, their blood sugar will just continue to rise and rise. This individual will also present with low weight. So this person might be very thin, but they have a really high blood sugar. That's the usual differentiating characteristic between type 1 and type 2 diabetes. This disorder is also autoimmune, and what that means is this person didn't do anything like have a bad diet, they weren't exercising at all to get it. If you're a nursing student, or if you know someone who has diabetes, you may have heard of these signs and symptoms. So this person will use the bathroom a lot. That's what we call polyuria in medical terms. This person may use the bathroom up to 3 times in 1 hour. This person will also have what we call polydipsia. Polydipsia is excessive thirst. So this person will keep drinking and drinking and drinking. They feel thirsty, therefore they keep urinating. And this person will also eat a lot. And the reason this person is eating a lot is because even though their blood glucose is high, their body feels like it's still not getting energy. Because remember, there is no insulin production. So this person does not have the ability to take in that glucose. So they will just continue eating. If you know someone who experiences these signs and symptoms, they may be a type 1 diabetic. And the treatment for it is insulin. Because once we give that person insulin, we can help their blood sugar decrease. That is type 1 diabetes. Let's talk about type 2 diabetes. When people say that they have diabetes or say that if you keep eating like that, you're going to get diabetes, most likely they're talking about type 2 diabetes. This type is very gradual, and it also covers about 90 to 95% of people who have diabetes. In this type of diabetes, insulin may be present, but this person's cells are not receptive to allowing insulin to be used. The 3 P's that we talked about in type 1 diabetes are also going to be in type 2 diabetes. That's polyuria, lots of urination, polydipsia, lots of thirst, and polyphagia, the need to eat a lot. The person with type 2 diabetes will also most likely be obese. So this is actually caused by lifestyle choices. And you'll see this person having recurring infections. Their infections are just not able to heal quickly. And this person may also have a lot of yeast infections. This person will also experience fatigue, and what that just means is being tired all the time. Remember that when this person eats, they're not able to use the glucose from the food as energy. Therefore, they're always very tired. So if you know anyone who has any of these signs and symptoms, or if you experience any of these signs and symptoms and think you may have diabetes, definitely go see your doctor. Get your blood sugar checked and see where it's at. Normal levels are 70 to about 120. Anything higher than that, if you've been fasting, is usually indicative of diabetes.